This young man suffered a spinal cord injury at T11, T12, 5 years before he came to us. After hospital, he has been told to forget about his legs. However, he did not give up and started training vigorously for 5-6 hours daily. As a result, over 3 years after his accident, he moved quite far, regaining the control of his legs, which was beyond anyone's expectation. However, for the next couple of years, he had little progress, and he had to battle hard just to keep what he already achieved. That's when he found ABR. Side view clearly shows how low are his ribs, being practically on top of his pelvis. His thorax has no depth, being just a bit deeper than his arm. Please note how effortful and unstable is his kneeling. His pelvis shakes and he needs a lot of effort to stay upright. He would lift his legs approximately 30 degrees off the ground. He would need a visual control to know where his leg was going. His movement of his leg would originate from extreme tension he would create at his superficial abdominal muscle. Therefore, he would be unable to move his legs beyond this 30 degrees angle. Yet again, he would use the tension of his abdominal muscles to control a descent of his leg downwards when somebody would bring it up vertical for him.
So you see your favorite thing about crossing over the legs?
When lifting his legs from sitting position, he would use the same trick. However, he could not control the lateral shaking of his legs, and his foot would just swing loosely.
Really good job.
2 years later.
That's why, that's simple explanation why you keep growing.
As always, his ABR program started from his upper body. A side view demonstrates a clear transformation of his ribcage. Even a quick glance shows that it is now 2.5 times the depth of his arm, and before it was just 1.5 times the depth of the arm at the nipple level. Respectively, a space between his ribcage and his pelvis appeared, allowing him the mobility at the waistline. As a result, his kneeling became effortless. He still needs a support by the hand because of the weakness of his knees, but his lumbar spine and buttocks now play a major part in his posture. His postural control no longer needs general tension of his entire body. He can gesticulate, move his head, speak, etc. All this is now possible due to the recovering role of the visceral muscles, which are the true force behind the posture control.
Sure. It's just, you see the red thing.
No. Red light for you, only for you.
Change of structure brought improved function. The movements of his upper legs are now effortless. His shaking is gone. The stable position of the upper body shows that this is now a pure movement which is done by the upper legs themselves.
Steve, I was thinking the last thing.
A control of the movement descended to the level of his knees. He is now able both to kick a ball, synchronizing the activity of the thigh and the knee, and he is now able to stop the movement of the knee afterwards by his own willing effort.
I will repeat with the other leg. It's okay.
Wow.
Very good. Yeah.
Improvement of the legs control is obvious. He can move his legs smoothly throughout the entire range of movement, showing complex interplay of muscle balance in the pelvic girdle necessary for the change of angles. He actually feels the muscles of his thighs now, and no longer needs visual control to know where his leg is going.
That's pretty good.
Of course, the newly awakened muscles are sometimes tender, and their strength and volume have to increase. However, the main thing is clear. They change and grow. Selective control of the knee starts developing, making controlled deceleration possible. Of course, the full control of his legs is still quite far in this case. However, 7 years after the spinal cord damage, the progress is still possible and consistent improvements pile up, building the foundation for further functional breakthroughs. 95% of the families doing ABR are parents of brain-injured children and young adults. We brought the example of this young man to demonstrate that at any age, following even the most severe damage to central nervous system, ABR gives a lot of room for progress. When the damage is severe, the progress is slow. When the damage is mild and the person is young, the progress is fast. However, the progress of structure and respectively function is always possible.
Great.